Hello, in this video I'll be showing you how to contour the strategic positioning base to accommodate mild limited hip flexion. Every Spex Classic Cushion has an inbuilt positioning system which we call the strategic positioning base. This technology is suited for a wide range of wheelchair users and their individual sitting postures and needs. The strategic positioning base is a system of stretchy pockets attached to the base of the cushion, allowing you to insert a varying amount of positioning pads. The placement of these pads creates specific contours to position and support the pelvis and thighs of the user. To accommodate mild limited hip flexion with a strategic positioning base, we want to create a sitting surface that slopes towards the front of the cushion, accommodating hip flexion limitations. The first step is to identify the extent to which the user is limited with the flexion of their hip joint. This will determine how many pads we insert or remove from the different areas of the base. Each pocket can hold up to 6 of the 10mm thick pads, potentially creating an estimated angle of 5 degrees on the top surface of the cushion for hip flexion limitations. For this example, we will assume the user has a mild hip flexion limitation on the left side, meaning that they cannot achieve a comfortable sitting position on a flat surface with the left hip. Therefore, they require the left thigh support to slope downwards in the cushion. We can achieve this by raising the pelvis by adding in pelvic obliquity pads on both sides and adding contouring wedges the length of the unaffected side in order to help the left thigh to be lower and the thigh angle to be slightly open. The number of pads required depends on the user's needs. We have now successfully accommodated for mild limited hip flexion within the strategic positioning base of the Spex Classic Cushion. The hygiene cover and outer cover now need to be put on. If you are unable to accommodate their hip flexion presentation on the Spex Classic Cushion, this would suggest that you need to consider the Flex, which allows for greater accommodation of hip flexion asymmetries and limitations of one or potentially both legs. This is demonstrated in a separate video. The strategic positioning base is simple to use yet highly effective to ensure wheelchair users are sitting according to their correct clinical evaluation whilst bringing comfort, increasing sitting tolerance and decreasing pain. Thank you for watching.